Good evening. Thank you everybody for joining. We're excited to have everybody here tonight as we have a topic on dermatology, speaking of breast cancer and all different kinds of information that will be given by Dr. Waibel. I'm Tracy Milgram-Posner, the founder of BRCA Strong. We're here to empower, educate, advocate women who are survivors, and thrivers to eliminate the feeling of isolation and help you feel whole again. We do this by continuous education, transformational photo shoots, medical panels, and fashion shows. I appreciate your time and all your dedication to helping us make a difference in the world. As we know, all these topics are so imperative. And right now during COVID-19, some people are having harder times getting different resources and continuous education. And that's what we want to do at BRCA Strong, is to continue to educate, as knowledge is power. Welcome, Dr. Waibel, and thank you so much for joining. She's here today from Miami Dermatology and Laser Institute.
Thank you, Tracy. And I just want to say it's such a pleasure to be here. I'm all about women. I have breast cancer on both sides of my family, both my mother and my paternal grandmother. So it's a cause that I've always watched, even though I'm a dermatologist and I take care of a lot of cancer patients. So I'd like to share with you tonight a lot about what we can do as dermatologists to help along the journey. So the lecture I'm going to give is about improving your life after cancer with dermatology devices. All right, let me see if we can get the slides to move. Okay, so there's many things we can do, and I think a lot of times that it's important to have groups like BRCA Strong that we can talk about them. So these are kind of the highlights of what I'm going to talk about tonight. How to prevent skin cancers if you've had radiation. If there's some emerging data on BRCA being associated with melanoma, we'll talk about how we can help with radiation dermatitis, nail problems during chemotherapy. Scars are really my passion in life, so we'll talk a lot about after reconstruction and the cancer is all gone, how lasers can help with scars. A little bit about gynecological complications at the end. So I'm going to jump right in. So the first thing I want to talk about is something called photodynamic therapy for treatment and prevention. And I think a lot of women that have had breast cancer and have had radiation aren't aware of this. And you probably were told this by the radiation oncologist, but a lot of this gets, kind of lost. I think there's a lot going on at this time. But for any of you that might have had adjunctive radiation therapy for your breast cancer, there does create an increased risk of skin cancer that can happen 45 years after treatment. And so living, I know this is a national organization, but if you live in somewhere sunny like we do here in Florida, or if you're in California, or if you've just had a lot of sun, that will also increase your risks. So we want to look at ways to prevent it. And this is one of my favorite therapies. It's called photodynamic therapy. And it's been going on for 6,000 years. And there's hieroglyphics of Cleopatra that she probably put tomato juice on her face and went out into the sun. Now, it actually came to medicine to treat lung cancer. I was a resident about 20 years ago. And at that time, the skin lit up. And at the time, we didn't know if this was going to be a chemotherapy side effect that caused damage to the skin or if it was going to be good. It turns out it prevents 80% of future basal cell and squamous cells when you've had this treatment. So if you've had radiation in the chest area, PDT can help prevent future skin cancers. And this is especially important for our younger breast cancer survivors in their 20s and 30s to help avoid another complication. I'm going to skip through this because it's, when you look at all the different ways to clear pre-skin cancers, which can lead to skin cancers, and in Europe, they even use PDT to treat cancer. We don't here in the United States, but this, a lot of you may have heard of, is called the blue light. You put a aminolevulonic acid, which is a liquid, on your chest, and it sits for an hour, and then you activate that with a light. And what that does is it then causes a reaction on your skin that kills the bad cells but leaves the good cells. Now, just to show you a patient, this is a male patient. I think it's my only male in this whole presentation. But he had pre-skin cancers on his face, and you can see me treating him with a laser. And then the picture you see on the right is after one treatment. And you can see not only are the pre-skin cancers gone, but the overall skin is healthier. This is a face of a woman, and you can see it cleaned up her brown spots, but she had had several basal cells. Now we'll go on to the chest. Some of these are breast cancer survivors. Some are just sun damage patients, but that's a before and after. And of course, you can see that the skin looks significantly better. But the most important thing to understand is that we're going to prevent 80% of future skin cancer. This is covered by insurance. And you do have to be careful, because if you've had a lot of radiation, you can have a very robust reaction. So again, this is something you're going to want to do with your board certified dermatologist. And pretty much most dermatologists across the United States do this procedure. And so after you've healed and you've had radiation, this is a great thing. So next, let's go on to talk about BRCA in particular, since you guys are BRCA strong. So there's still controversy with this, but I think you've probably heard it at other lectures. It's important to start the dialogue, is that women that are BRCA1 or BRCA2 mutations may have an elevated risk of melanoma. So the studies are inconclusive, but we're starting to see that DNA damage could extend beyond just breast and ovarian cancer risk. And there was a study in 2015 that showed that there was a connection between BRCA1 and melanoma. And then in 2018, there was a possible connection with BRCA2 and melanoma. And then most recently, P53, which is squamous cell, could be a link with BRCA. So give us a little more time. We're trying to piece these together, but we do want to make sure that all of our breast cancer patients are getting checked by a dermatologist at least once a year if you're over the age of 40. So, and just to show you how far we've come in dermatology, this is where I practice on Thursdays. It's the Miami Cancer Institute. And one of the things that we have now is advanced imaging equipment. And this is cutting edge, but you're going to start to see it in your neck of the woods, wherever you are in the United States. So when we talk about skin, artificial intelligence, and actually imaging the skin without taking a biopsy is really being driven in cutaneous oncology. So there's a new device that you may have had done at your ophthalmologist called the optical coherence tomography. And this is really important, and this really bothers me every day. I've had a lot of patients with skin cancers that are huge, like the size of a cherry tomato on their temple. And I send them for PET scan, and the radiologist tells me that their PET scan was negative. And I said, they have a huge tumor on their head. How can it be negative? And the answer from the radiologist was, well, PET scans aren't very sensitive. And so you have to have a tumor greater than 10 millimeters for a PET scan to pick it up, which is not very reassuring, because if tumors greater than 10 millimeters don't have very good prognosis. So then MRIs are a little bit better. X-rays go down to 1 millimeter. Ultrasounds are a little bit better, but OCT can see tumors down to 1 micrometer. So we're really needed in medicine to these new technologies. So we can use optical coherence tomography in the body to look at tumors. Another thing that's emerging is the Vectra system. And the Vectra system is something that you can step in your skivvies, and it takes 92 pictures of you. Now, not everyone needs a Vectra, and right now there's about 7 of these devices in the United States. They have them at Memorial Sloan Kettering. There's some in Virginia. We have the one in Miami, but they're going to be coming online more and more. And since 1 in 5 Americans get skin cancer, it's actually the most common cancer in the human body. It's the #1 cancer in women. Breast is #2 in women. Colon's #3. But this helps us track melanoma. So what it is you have 92 cameras that take pictures all over your body. And then I think this is going to show my little video. Come on, video. There he is. So it makes an avatar of each patient. It's super cool if you've seen the movie Avatar. And so this is your body and all of your moles. Then we get what I call the pizza chart. And the pizza chart shows every single lesion on your body. And then we can, as doctors, go in and say, well, show me the biggest or the darkest, and then we can track it over time. Now, the importance of this is we can find melanomas at the very first stage. And as you know, the sooner you find a cancer, the more survival, the higher your likelihood of overall survival. And so again, we can press on this button and follow and look at each lesion and see if they have any features that are concerning. So in Miami at our cancer hospital, the people that we recommend Vectra is if you have a history of atypical nevi, more than 50 moles, or if you've had more than 5 skin cancers, we would consider this technology. And again, stay tuned. We're going to look into the BRCA connection. Now, the other device we have looking at early skin cancers is called a reflectance confocal microscopy. And again, these are in practice, but they're still often used more in research or tertiary care centers. But this is a diode laser that can actually do a biopsy of the skin without doing a biopsy. So we can say right then and there, this is an image on the left that's normal. And then on the right, all those white squiggles that look like spaghetti, that's melanoma. So right then and there, we don't have to do a biopsy. We don't have to send it to a lab. We don't have to wait 2 weeks. We can literally say, this is melanoma, and we're going to fix it. I showed you the OCT, but just to show you how easy it is, this dark circle is a basal cell. And again, we can do this bedside. It takes about 5 seconds. And if you watch this fly through, even you, if you're not dermatologists or doctors, you can see that dark shadow. And again, we're really moving into artificial intelligence in medicine, which is going to save a lot of needles and cutting and things that can help us move forward. So the other thing that I'm a big proponent of is oncodermatology. For any of you that are either currently on or have had chemotherapy or now the immunotherapies, there are a lot of toxicities. There's a lot of side effects in the hair, skin, and nails. And so most of you, be sure if you're having a problem, go see your dermatologist. We're actually trained to help with the dry skin, itching, any rashes, any nail changes that you get during chemotherapy. Next, I'm going to talk about radiation dermatitis. And there's a program called Brighter Futures. I know they have it in some places in California that dermatologists do a weekly or monthly talk with any women going through chemotherapy to help manage those side effects so you're not suffering. Now, one of them that I deal with a lot is radiation dermatitis. And a lot of radiologists don't know this. And you can use lasers to mitigate both acute and chronic radiation dermatitis. So it's better now that we have the photons that are better, stronger radiation versus our electrons, but you can still get radiation dermatitis. There's a light called the LED, the light emitting diode, and this light has been extensively studied. It's Dr. Gilhurst at Boston College was the first to do it, but it's anti-inflammatory. So if you see an acute radiation dermatitis, and you can do this during radiation, and I do this routinely, this is 5 minutes later. So a patient comes in and they're in a lot of pain and suffering from radiation on their breast cancer. You can put them under this light, and this is an infrared healing light. And in 15 minutes, the pain, the itching, and a lot of the inflammation is decreased. So this can be done, again, I work with the radiation oncologist all the time during radiation to help. Now, some patients, years later, you'll finish your radiation, you'll finish your reconstruction, and you'll see the changes like this left breast that has chronic radiation dermatitis. And this can be treated with lasers to improve that color change, which, you know, it does, and improve the skin quality. And the cool thing about these devices is they're healing. They're not ultraviolet radiation, and they heal within hours. And the way that the LED works for the acute radiation is it actually works, and I'm not going to get too geeky here, but it works on the mitochondria, and that releases oxygen. And these lights are pretty neat. If this was published in Nature, but they've done studies where a mouse was having a stroke, and they shine this light on the mouse, and it reverses the stroke. And there are Olympic athlete runners use this during the last Olympics, and they shine it on their legs and their muscles, their tendons, and they were running 2 to 3 seconds faster. So these are very exciting anti-inflammatory lights that are very easy. A lot of dermatologists have these in their offices. So if anybody's having those problems, you can go to your dermatologist and get those. And this is what they look like. We have a red and a blue and a yellow light. I have them all in my practice, but you literally sit under them for 15 minutes and it helps a lot. Now, other things that can happen with breast cancers are the chemotherapies and the immunotherapies. The new immunotherapies are much safer than chemotherapies because they're antibody-based therapies, but we are seeing a lot of skin changes with those. So again, make sure you're going to your dermatologist and they can help manage them. We almost never stop therapy for a cancer patient if they're having a hair, skin, or nail side effect, but we can manage it. We view the cancer and the treatment of the cancer with a functional chemotherapy or immunotherapy as the most important thing, but we have ways to help. We can help with skin, we can help with hair, we can help with nails. So one of the things that happens is we have a lot of nail problems because nails are attacked because they're rapidly growing and the chemotherapy is also getting those. So I have a list of things that can happen. You can get elevation of the nails, bows, lines. When your nails get affected, fungus and bacteria tend to go under them. And again, the last thing we want to do is give a patient that's undergoing complicated cancer treatments another pill or drug. So there are lasers that do bulk heating to kill fungus and bacteria under the nail. And this is a very apropos thing right now because heat kills bacteria, fungus, and virus. And we know that's why the body has a fever because the body's trying to kill it. So we usually use lasers that can target problems with the nails and make them more normal. So this is a patient on the left that was having chemotherapy side effects, and we use the laser and you can see that fungus and the nails growing out more normal. This is another one that I think probably a lot of you know about, but for those of you that don't, this is a really cool story. Bimatoprost is an eye drop that was initially used for patients with glaucoma, and it was used almost exclusively in, grandma, grandpa, silver eyelash patients. And after they would use these drops for a few months, their eyelashes would become dark and long and super strong. So the maker of this Allergan said, this is great. We're going to make this a cosmetic treatment. And so it's now FDA approved for stimulation of eyebrows and eyelashes. I use it on, it's FDA approved for upper eyelashes. I use it. This is one of my breast cancer patients. And I used it for her in her upper and lower eyelashes and eyebrows. And within about 2 to 3 weeks, you're going to see growth. Eyebrows and eyelashes grow on 11-week cycles. So within 2 or 3 months, like sometimes people's eyelashes, like you could braid them. So if you're just finishing chemo, or if you want to use this during chemo to try to stimulate growth, it's very safe. And again, you have to get this through a prescription, but it's quite wonderful, and it really helps a lot of patients. It doesn't work all the time, but it certainly is wonderful. Now, the last two topics I'm going to share tonight are probably the two I'm the most passionate about, and that's talking about fibrosis. And fibrosis is the fancy word for scarring, and fibrosis causes many problems in the human body, but I'm going to start with my favorite thing to talk about, which are fixing scars and breast cancer scars in particular with lasers, and then I'm going to finish off with a little bit about vaginal rejuvenation in breast cancer survivors. So cutaneous fibrosis, i.e. scars. Scars are truly important in medicine, and I know I'm talking to a group that I don't have to share that with. They can really experience great loss in quality of life because every time you look at that scar, you're reminded of a life event that in most cases is not a good one. And lasers really came to medicine to treat birthmarks in children, but they're a miracle for scars. And there's an emerging field called medical photonics that lasers are healing the human body. So this is my fun for the day. I call it Scar Wars. And so we win Scar Wars. And this laser came out in 2007, and it's called the fractional ablative, either CO2 or erbium. And it's actually the smallest wound that the human body has ever seen. And if you have a scar from your breast cancer reconstruction And some of those end up being thicker because the breasts are actually under a lot of tension. This laser removes the bad scar and the healing results in almost normal skin. So I tell patients it's like boiling water on the stove and turns into steam. We literally remove little pieces of your scar and then we let the body heal that tiny wound. So it's fairly magical. And if you look at this little picture, that's the micro, you can see these little channels of where we remove the scar and then it's able to heal. And when we look at laser treatment of scars, it's very customized. And this is actually one of my burn patients, but it's a great example that I like to share with patients. So scars are complicated and everybody has a different scar. So this is a burn patient of mine, but it's on the breast. And as you can see, this scar has areas that are red, areas that are white, areas that are brown, areas that are elevated, and areas that are depressed. So I'm very blessed that I have many, many lasers. I have about 75 lasers. And what I do is I do a unique recipe for each scar to undo the things that I don't want. So I used a laser to take away the red. I used a laser to stimulate the white. I used a laser to flatten the bumpy, and I used a laser to lift the depressed. And this is after 2 treatments. And so as you can see, it's not perfect, but we're able to get patients to have more normal life. And now if she does a tattoo of that nipple, you can go to the beach, you can wear dresses. And you know, that was only after 2 or 3 treatment sessions. So I always tell patients when we do laser treatment on scars, it's like going out to dinner. First, we look at the color of the scar. Is it red, white, or a brown? And a lot of our, I practice in Miami, we have ethnic skin of every place in the world. So a lot of our darker skin types will get a discoloration or a darker color. And then the main course is that laser I showed you earlier, that CO2. And then dessert, there's lots of options. And again, it's customized to each patient's scar. So in the beginning, you know, this is a scar. I think this was an implant patient. I have a combination. It's all breast, but she has the red elevated scar. And this was just one treatment with a laser to take away red and a CO2. And you can see how that smooths out the area around the areola. And it's very normalized. Next, again, these are other surgical scars because I know when we were coming on, somebody had a tram flap and sometimes there's skin grafts. So if there's scars in other areas, again, we can camouflage those scars. Linear scars, you know, if you have any lymph nodes that you've had excised under the arms and you need, we can help with those. Again, this is an abdominoplasty, but if you have a tram flap and need it, it just minimizes and helps camouflage. And again, we're using combinations. Hyperpigmentation, again, if this is just, if you have darker skin or this darker color, we have lasers that are safe in all skin types that can lighten this up. White is by far the toughest. This is a burn patient of ours. And again, I was focusing on the red. The patient, the one that said to me, hey, Dr. Waibel, look, the white got better. So don't be discouraged if you have any different trait of your scar. I wanted to show you these examples so you know that lasers can help. So now we look at, you know, once we look at color, now we're going to look at, is the scar too bumpy or too flat? So this is a breast scar that we call these hypertrophic, and you often will see tension in certain areas because our breasts actually pull down because of gravity, and so breasts often have challenges healing. And so this is after 2 treatment sessions with laser, and you can see the color's better and it's a lot flatter. The other thing that I'm a huge fan of is silicone gel sheets. I'm not a huge fan of just silicone gel, and I could do a whole lecture on that. But my favorite brand is Oliva. You could get it on the internet. On Amazon, you can wash those. So even if you have a port or if you have, you know, any type of scarring, get those Oliva pads on there. They're silicone gel sheets. You know, this is another patient. You can see this is a really good scar. But again, we can make a really good scar better. So this is after 1 treatment. You can see in that tension zone down there, the brown's a lot lighter. The texture's a lot smoother. This is one of our breast cancer reconstructions red. We made the red better. Now we'll get it tattooed. This is a breast cancer patient that actually had the dehiscence at that tension point. And you know, again, I like to laser immediately. If I see a wound breaking down, we've done a lot of research that early intervention with lasers helps wounds heal. If you have a wound that's open more than 28 days, its chance of forming a bad scar is very high. So again, we want to get into your dermatologist. Keloids, you can get keloids on breasts. There's genes, there's about 6 genes. They came from Africa, but anybody can get a keloid. And again, you want to treat these with lasers and combinations to help. Again, keloids on the ears, we can definitely help a lot. I touched on this a bit, but again, I think it bears repeating. Early intervention is very important with scars. You want to get into your dermatologist. And, you know, I know you're probably getting tired of seeing doctors. You've got your, you know, your breast surgical oncologist, you've got your, maybe your radiologist oncologist, you've got your surgical oncologist, and now you've got your plastic reconstruction team. And now I'm saying go see a dermatologist, but we really understand the skin. This is my brother. He's a symphony conductor, and he once told me that it's really hard to conduct a symphony because the strings are over here wanting to do this and the horns are wanting to do this, and he wants to do it his way. And he was lucky enough to be at Indiana as a conductor, and he had Joshua Bell. And scars are actually what I call my microscopic orchestra. So there's so many things going on when you have a wound or a surgery that there's a lot of things we need to do to heal a scar. We have to prevent infection. We have to prevent tension. We need to wear compression. And we want to start treating that scar as soon as possible. So this is another, you know, again, a major scar patient of mine. But what we've learned, this is a child from New York that the mom called me and said, my child just got burned. I'm going to fly to Miami. I said, don't, I won't treat you for a year because that's what the surgeons told me. And the mother literally hung up the phone, flew to Miami with her child without an appointment, showed up in my office, and she said, you're lasering my child. This was in like 2005. And I said, okay, I have 4 kids. I would do that. And I lasered her child and her scars melted away. And so that was the beginning of my journey. And this little kiddo on the right is a child that I waited a year to laser with the exact same age and injury. So I learned early on that the sooner you laser scars, the better. Now, surgical scars from breast cancer surgeries tend to improve over time. So if your scar's looking good, you don't necessarily have to have this done, but you can get hypertrophic scars as soon as a month after surgery. So if you're looking at your breast cancer scar early on and you're seeing it not going well, make sure you get into your dermatologist and have them manage it. And then if you're on this call and you're like, I had surgery 20 years ago, we can still help. This is my last topic, again, that I think is very important to talk about. And it's using lasers to treat vaginal atrophy. Now, you might have heard there's some controversies here. However, what's not controversial is that we know that subgroups such as breast cancer survivors have vaginal dryness in at least 23% of patients and 61% of postmenopausal patients. And you know, if you're a 20 or 30-year-old that has breast cancer and it's having this has real quality of life issues. So, you know, having early menopause and vaginal atrophy after breast cancer is very common and it's not talked about. And again, I'm all about women, and I just don't feel like there's enough advocate for women in these issues. You know, if this was a man with a problem, it would have been solved. We sort of sweep it under the rug. And in July 30th of 2018, the FDA came out with a warning, and I just want to make sure everybody understands what the warning was. They said that there wasn't enough science yet to show there was safety of these devices. And I was the first one leading the band on this. I'm on the board of the American Society of Laser Surgery and Medicine. I've been on several other of the national societies in my specialty. And we knew these were efficacious, but there hadn't been enough randomized controlled studies. So a lot of the OBGYNs were using them, and there were some small complications, but overall, I want to say these are helpful in most patients. I do it in combination with OBs to make sure that they've examined the patients, and I did do an FDA-approved clinical trial, and in that trial, these patients all had vaginal atrophy from breast cancer, ovarian cancer, or uterine cancer, and these were my patients, and this was what they said. And again, I know a lot of you know this, but some said I had no sensation, my vagina was dead, I don't have sex since the ovarian cancer because my perineum tears, there's pain and bleeding, and it feels like knives when I have intercourse, and then the labial lips are cut and bleeding. And so again, we are just letting women suffer. And so there is a laser. The laser that I use to treat scars in the last section can be used in the vaginal area to actually thicken the inside of the vagina. And this is a video of how it looks. It's a single-use applicator, so it's very clean, and you stick it in to the area, and it creates little fractional holes along the vaginal mucosa. And this does the same thing it does in the skin. It creates a wound healing response. So you're taking that atrophy and you're saying, okay, guys, let's make more mucosa, which makes the mucous membrane moist. So if you, this is actual live, it does not hurt. The initial OBGYNs were like, do 3 treatments 1 month apart. I totally disagree. I think you do 1 treatment, see how the patient does, and do the next one when the patient needs it. This is a picture of from Dr. Castillo. He's a urogynecologist in California, a good friend of mine, and you can see he took a picture inside the vagina of those little white holes. There's no pain, there's pinpoint bleeding for a day. And this is the pathology showing the thickening of the vaginal mucosa and the moisturization. You can see all those thickening of that purple and all that white is mucosa, and that's much more liquid. So now these are what my patients said after our randomized clinical trial. They said, I feel more desire than I have in the past 2 years. This was the first successful sex in a long time. My libido increased 4 to 5 hours after I left, and leakage stopped. I'm not sure that connection, but patients do say it. My partner says I feel tighter and wetter, and I don't have dryness anymore. So again, oh, and then I have a patient that I think...
I'm 50 years old. At the age of 31, I had a complete abdominal hysterectomy. At the age of 41, I had both of my ovaries removed, which threw me into early menopause. Since then, I've suffered with extreme vaginal dryness, which made sex nearly impossible and extremely painful. I've taken hormone replacement therapy, which I continue today, and local vaginal hormonal creams, unsuccessfully treating the vaginal dryness. I've had 3 treatments with the Diva laser and have experienced a significant increase in moisture, which has made sex less painful. I would very much like to continue with the Diva treatment just to see how far it can take me.
So that's just one patient. And again, I know obviously our breast cancer team can have the hormone replacements, but this just shows that there could be a role for laser with vaginal atrophy. And then this is my last slide. I helped write part of the chapters with Caitlin Kiernan on Pretty Sick, which is a beauty guide for women with cancer. If you guys don't know about this book, it's a beautiful book for women, and it's got some humor and inspiration in it, but I think it's a wonderful book. So I'm going to end with my quote that says, you're in front of someone who is suffering, and you have the tools at your disposal to alleviate suffering, and you act. And I just want to wish everyone good health, be safe, be well, and thank you for letting me be part of your amazing organization.
Thank you so much for a phenomenal talk. I know I have some questions, and I'm sure some other ladies do. What I will do is, at this time, I will unmute everybody. Dr. Waibel, if you want to cancel share screen from your side.
Let me see. Stop share. Okay, there you
Perfect.
go. Good. Okay.
Perfect. Well, thank you again for your time, your education. I know personally, again, I'm going to walk away with a lot of information here. As a BRCA carrier myself, I'd like to open up one question. You brought up a really good subject on squamous cells, and prior to being diagnosed with BRCA, I actually had squamous cells that came back on my foot and had like 38 staples in my foot, and never realizing that there could be a correlation with BRCA. Do you know if there's any current clinical trials going on for that, or for melanoma with BRCA? Because I know personally I'm into clinical research, and I see that you do that. So I would love to know if there's more information, or if there's studies out there that women can join to help make a difference in the education part of it.
Yeah, so no, it's a really good point. So yeah, there are some ongoing, the first thing that the medical oncologist, and I'll send you the 2 articles, Tracy, that I referenced with the BRCA connection with potentially with melanoma. And again, it's inconclusive. What we're trying to do, and I urge all of you have been genetically tested. What we need to have your geneticist do is start to look and see if you have some of those other genes, because we get 10 genes a year or more in these arenas. But yeah, there are some clinical trials, and I can forward those to you. They're usually on nih.gov.
Okay.
For all of you, you can go there and look at clinical trials, but I'm happy to help you with those. And I know there's people from all over the country. Of course, Memorial Sloan Kettering and MD Anderson have a lot of the best studies. But we have a really comprehensive cancer network, and we try to get patients to the right places. So Tracy, I'll forward those to you, and maybe you can post them.
Perfect. That would be great. I appreciate it. Does anybody have any questions? Let's unmute. Tammy, do you have a question?
Yeah, so I have some pretty gnarly scars from all of the Leticia. I had to have a breast reduction first. And then in order to have my mastectomy and my lutetium C flak procedure was on my back. So my scars have kind of stretched out. Like I tend to fall asleep like this, and one side is bigger than the other, and it looks, and they're purple. Yeah. My last surgery was like, and I'm very fair skinned. My last surgery was August 29th. How many treatments do you think would it take to kind of lighten something like that up, or just, I'm very uncomfortable wearing like anything that would show my back because the scars are just ginormous, and I don't think my plastic surgeon did a very good job.
It won't. Well, so the first thing is, if it's mainly if they're really stretched out sometimes, and I can, if Tracy can give you my email and you can tell me where you are, and I can, sometimes you can go in and do revisions, and that is usually done by a reconstructive surgeon. Now, what's hard is in the world of surgery, there's breast reconstruction people, but then there's like general reconstructive people, and then there's plastic surgeons, and they're all very different. So sometimes after you're through all your therapy, sometimes the best thing is to go in and do a scar revision, but the laser can do it as well. So if it's really red, is easy with lasers. There's a pulse dye laser, an IPL. You can usually remove the red, and the red, when it goes away, is great for patients because it's like a red flag. I say your eye goes to that. So if it's just the red color, that's usually 2 or 3 laser treatments. It's really easy, no downtime, no big deal. But if it's actual thickness of the scar, then you may want to consider a Z-plasty or revision. And I can help you again with people I know. I do a lot of work with the Wounded Warriors, and there is a group of amazing reconstructive surgeons around the United States that all they do is reconstruct, warriors and cancer survivors. And it's very different from your run-of-the-mill, I want a facelift or I want breast implants. And so but I'm happy to help in any way I can.
And I know this is good, obviously BRCA, all of the, once you've had ovarian cancer and then you get diagnosed with the BRCA gene, and, you're kind of paranoid about every little bump or bruise or anything that you get on your body because my father just had skin cancer. My mother died of multiple myeloma. My cousin right now just got diagnosed with breast cancer, and she's BRCA positive. Like everybody in my family has some type of cancer. Now, how do you know, if you have a little bump, like I have a couple bumps on my leg that they look like pimples, but they're not pimples. You know what I mean? They're just kind of circular. How do you know when, okay, I need to go see a skin doctor because I have the gene and this could be skin cancer?
Well, I would say for all of the BRCA women on the call, I would go to a once a year appointment with a dermatologist for what we call a skin cancer screening or a total body exam. I tell people if something is changing, growing, bleeding, burning, or itching more than a month, but changing is the cancer grows, cancer's,
right.
That's its mode. I'm going to eat all the food and I'm going to grow bigger. If it's something sort of hanging out and staying there, it's not doing anything, usually it's okay. But again, because we're seeing these associations with melanoma and possibly with squamous cell, you know, I tell every woman at the age of 40, you should get a total body once a year. Insurance covers it, a board certified dermatologist, and, you know, they should check it out and they're going to know. And if they're worried, they'll do a biopsy. But again, number one cancer in the body is skin cancer. You should absolutely get a skin cancer check. Number two, breast cancer mammograms. Obviously, you guys. Number three is colon. So colonoscopies every 5 to 10 years. So every person's wellness checks should be based on their own personal history. But you should definitely see a derm once a year.
Once a year.
Yeah.
Okay, Tracy, we gotta, I need your help. We gotta schedule all the, and it's scary to schedule all of these. And I, you know, even though my last surgery was August 29th, it's now during the pandemic, it's almost like, do you go to a doctor for these screenings or do you just wait because it's dangerous to go to a doctor? You know, there's this kind of anxiety, but then if you wait too long, what if something spreads? What if something, you know, it's, I don't know. Maybe the psychologist can't answer that. What do you do?
Well, I can answer the doctor and then we can hear from the psychologist.
Yeah.
If you're really, truly worried about something, go to the doctor, because we are seeing right now what I would call the post-COVID, where people didn't, and it, you know, it's better in medicine to catch things early. I don't know that I would do a pure wellness exam or a pure dental exam right now, because depending on where you live, of course, because, you know, different places have different risks. But if you're worried about something medically, go see your doctor would be my medical opinion, or at least do a telemedicine and get their opinion, because what we don't want to do is miss something and wait 3 to 6 months, because that can make a big difference in medicine. But I'll let Dr. Lucette answer as well.
I completely agree. Yeah, I agree that, you know, your medical and your health, your physical health prevails here. And I think, you know, reaching out to your team and asking them, you know, do you feel that it's safe? Do you feel that it warrants a trip to the doctor? Maybe they can kind of screen you through telehealth, as Dr. Waibel was saying. I think it's the safest thing. And yeah, there's some anxiety. I can definitely, I think it's important to acknowledge, and I think it's important to also communicate to your doctor and let them know, you know, I feel very anxious about coming to the office, and asking them, you know, what safety precautions you have in place to make sure that I'm going to be okay. And, you know, always reaching out for help if you feel that the anxiety is getting in the way of you getting the help you need, as far as, you know, your physical health or anything else that you need to get done. Yeah, always.
Thank you so much.
Ariana, did you have a question?
Yes. Hi, everyone. My name is Ariana Ruiz. I am joining you guys virtually from New Jersey. I have been a follower of Dr. Waibel's Miami Derm and Laser Instagram page, and I am here. I am not a cancer patient, but my mom is. She wasn't here on time. I just learned about this like an hour ago, so I was like, I cannot miss the opportunity. So my mom is a breast cancer survivor, I can say, because she's cancer free. Her mastectomy was 6 weeks ago, and she's starting radiation in about, I think, July 4th, around that week. So my interest was like, yes, this might be an opportunity of me to learn any tips or just procedures that are out there. By the way, I am a medical profession. I am a recent medical student graduate, so I graduated in May. But I know nothing about this, okay? I'm just here as, you know, a daughter that I just want to use the resources, and I am glad I discovered this BRCA Stone Instagram page. That's why I like social media. It provides as a way to connect to each other and not feel alone. And sometimes I love the presentation today, and well, I've been talking a lot. Yeah, basically my question is now, my mom has a lot of complaints about her skin. She is very prone to hyperpigmentation, which is like just patches of browning on the skin. And she's so worried about radiation and how it might affect her outcome. How is she going to be left by scars or anything? And you have talked about different treatments. but is there something she can do now before she starts, or any of the survivors that have gone through it can also tell me, is there anything she can do to maybe so the damage is less to the skin in layman's terms?
Well, I'll take it and then the rest. So the first thing you want to make sure is you're finding a really good radiation oncologist, because, and again, I'm a dermatologist, so I might mess this up if anybody on the, there's the older electron radiation beams, and those are much more damaging than some of the newer radiation, because the skin, you know, you have to go through the skin, and the electron beam is my understanding that it targets the cancer area and it doesn't hurt the skin as much. So the radiation specialist is very important. The other thing is I'm a huge fan of just overall wellness. I think, you know, and there's been a lot of studies that we talk about in our cancer hospital. Exercising every day is better survival for cancer patients, as well as longer relapse-free periods. And I just think it makes you more healthy. I'm a huge fan of eating super healthy, antioxidants, blueberries, like, you know, be the best you can be. On the front end, though, I think find the best doctor. And then if you start to see those signs of radiation, dermatitis acute, find an LED, calm it down. And then after radiation's treated, we can help with the brown and all that. And there's great dermatologists I can refer you to in New York and New Jersey that can do this. But the thulium laser is the best for brown. So I'll turn it over to the BRCA
No,
Strong.
thank you, and thank you again, everyone. Yeah.
No, any questions, Ariana? If you want to message me on Instagram, I'm the founder of
will.
BRCA Strong. I'll be more than happy to send your mom. We'll send her a care package, a book, and some other information, and we could give you some information as well.
We'll be so excited.
And you could join our private group on Facebook, where we have a lot of other women communicating like things about radiation and about chemo and different ways to prevent and things to do and antioxidants.
Awesome. I'm so glad. Thank you. Yeah.
Perfect. Does anybody else have any other?
Can you all hear me?
Yes.
Sorry, I'm also on a call. I'm multitasking. So during radiation, my radiation oncologist suggested that I use Aquaphor and the Utterly Smooth cream, and it was beautiful. Like I still look like I've been to, you know, a tropical paradise over here and not so much over here. But as far as like the redness and all of that, and I only had 20 rounds, but that's something to consider too. But I would definitely listen to whatever they tell your mom to utilize. And I don't, you know, every radiation oncologist is going to be a little different, but through my journey, I found that like just general hydration of the skin, like making sure like non-scented lotion, you know, look at what's in the actual lotions that you're putting on and stuff like that's important too. Just my thoughts.
Thank you, Chelsea.
I know the Utterly cream works really good. My mom is off the call and she's going through chemo. It's called, what is it, Chelsea? Utterly
Smooth cream, and you can get them both at like CVS.
It comes in like a cow jar, like my mom's on treatment. And
that one, yeah.
Yeah.
It's worked amazing miracles for my mom's skin. I mean, she's not on to tell you, but like that's the only thing that I found over the counter. She didn't want to go to another doctor. So I'm like, just try this. And it happened to work a miracle for her. So does anybody else have any other questions?
I'm definitely interested in finding out more about the vaginal rejuvenate or whatever, you know, that sounds interesting to me as you know, I had a hysterectomy, I had ovarian cancer twice and finally had a full hysterectomy and no drive, I wonder if that would work. I don't know, you know, so.
Dr. Waibel, is it similar to Mona Lisa?
Yeah. All the Mona Lisa is a CO2 laser. There's, you know, they all have, you know, these crazy names, but there's CO2 erbium and radio frequency. And like I said, the CO2 has a little bit higher complication rate because it's really hot, but the Mona Lisa is the most widely found, but they all do a similar, you know, we kind of are stimulating new growth in that area. And again, I don't think it works in every woman, but as long as your OB/GYN has said you can have it. I mean, again, as a dermatologist, I never vouch for that part of the body. But then because we're laser experts, once I have the clearance, I do the laser because, again, but it's different in every state. So
Do you have to get approval from your gynecological oncologist for something like that?
I
How do
mean,
you?
it depends where you are in your treatment.
I'm in South Florida, but I mean, I'm finished.
Yeah,
They don't have any body parts left down there. It's all gone. They took it. It's empty.
You know, with the Mona Lisa, I guess my question is like, I had Mona Lisa done 4 years ago, and then I had 2 years ago, I had a reevaluation, I guess, of it. And they did one treatment and they said it was going to last like almost more than 2 years ago. And it helped with certain things, but it burned. I got burned. So like, that's my fear when you talk about it, like, yes, the vaginal atrophy and the dryness, but I know it helps with like leakage, right? And it helps with a couple other.
Well, we don't know. And that's where, I mean, number one, that again, I use the erbium because I have 5 CO2s, but you know, and you have to be careful how it's used, what the settings are. You know, you're not supposed to be burned, obviously.
Right.
And, you know, it's, there's the FDA approval is for improving, it's a fractional resurfacing device approval. And now the companies are going back to get vaginal atrophy improvement. But the leaking and all that there's no science to prove it. Most of that's more anecdotal by patients. And like I said, not everybody like chemotherapy, like not everybody responds the same to every therapy. So I usually tell people try it once. If it helps, you know, maybe you have to do it once a year, maybe you have to do it every so often. You know, every patient's on a journey.
Perfect. Does anybody else have any other questions? Go ahead, Chelsea.
Sorry, so I'm in menopause. I'm on hormone therapy to stop that. Eventually we'll have to have my ovaries out as well. Obviously with that comes acne and all of that type of stuff. So through chemo, I did pretty well. Like I felt like my face was like, the hyperpigmentation went away. And then now I'm starting to get my color back, and hyperpigmentation is like super prevalent on my forehead. And then acne, not like cystic acne, but just, you know, zits like I was 16 again. Do you have like any suggestion? I've tried everything from like Drunk Elephant, like super expensive Sephora stuff, to the cheapest stuff that dermatologists recommend, but I'm not having any sort of relief in it.
Well, of course, acne is multifaceted, but are you pointing mainly to the jaw area? I mean, is that where you
Yeah.
get? Yeah, so that's usually hormonal induced, and it's a change of hormones. You know, a lot of people think acne and things are always increased hormones, but it can be any change. So, you know, there's many ways to kind of approach this. You know, I'm a huge fan of, have you tried Retin-A? So
Actually,
there's Retin-A. The PDT I talked about actually treats acne as well. So depending on your insurance, if you have a high copay for meds, but you can get a procedure done, that can help. If you're still going through a lot, you may, you know, spironolactone is another one, but again, you have to talk to your oncologist about this. I love Accutane if it gets to be a problem. Love Accutane. It's vitamin A. I've given it to my kids like 4 months and you'll never have acne again. So, you know, I think that's a good conversation for your dermatologist and your oncologist to have, but you should not be suffering from acne. There's a million ways to treat it, and life's too short. You're already going through enough. The second thing, and I can't see it, you look beautiful from here, but usually the brown is melasma, and that is again a change in hormones. And sun protection, I don't like hydroquinone because that's a, you know, again, I'm a purist. You know, I'm not, my daughter's vegan, I'm pescatarian, but the less chemicals I think cancer patients have, the better. So I'm not a huge hydroquinone fan, but there's lasers that help. And, you know, just working with your OB too to see what's going on with your hormones. You know, you probably, like you said, they're blocking, but let's try to figure out if there's other ways around it. Try to decrease eating hormone related foods too. Sometimes we know dairy can have effect on acne, and also be patient with your body. Usually it normalizes after a certain amount of time.
thank you very much.
Of course, good luck.
Well, thank you everybody for joining. Dr. Waibel, I will reach out to your girls in your office to see maybe if we can get some information up like on BRCA Strong for scars and some other details that you went over so we can continuously share and educate the girls. And I really appreciate your time and commitment to coming on to educate the community. I will go ahead and forward you the recording probably within the next 24 to 48 hours. It will also be up on our website for all of you ladies that want to go ahead and share and have questions. And for those of you that don't follow Dr. Waibel on Instagram, you guys can follow her through our page. And we look forward to having you on our next call. And thank everybody so much for joining.
Thank you.
Thank you, guys.